Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Diabetic ketoacidosis versus the hyperglycemic hyperosmolar state. So first let's look at the DKA. DKA stands for the diabetic ketoacidosis. So here it is seen in what type of diabetes? It is seen in type 1. Type 1 of DM. And what is the clinical features? It presents with the abdominal pain. Then it can present with small respiration. Then it can also present with the fruity odor of breath. Fruity odor of the breath. Next, what will be there are some numerical values we need to know. That is, what are the glucose level? The glucose in DKA will be 250 to 600. Then looking at sodium will be 120 to 125. Now what about the osmolality? In osmolality it is 300 to 320. Then looking at the plasma ketones. Plasma ketones will be it will be very high, positive. Then moving on to the serum bicarbonate. Serum bicarb. Serum bicarbonate will be less than 15 milliequivalents per liter. Then arterial pH. It is going to be 6.8 to 7.3. Now question arises on the arterial PCO2. So arterial PCO2 will be 20 to 30. And this is in mmHg. Now let's look at the Ag, that is the anion gap. Anion gap will be significantly increased. Next, moving on, let's look at the HHS. HHS stands for the hyperglycemic hyperosmolar state. So here DKA it was type 1, here it is going to be type 2 of diabetes mellitus. And what are the features? It is altered sensorium and coma. It is nothing but altered sensorium as well as the presence of coma. So it has altered sensorium as well as the presence of coma. Now let's look at the glucose values in case of HHS. The glucose values here are significantly increased. That is, it is 600 to 1200. Now sodium level is slightly increased. That is, it is 135 to 145. And osmolality. So in short, all the values they are increasing in terms of the HHS. Now looking at plasma ketones, we are writing it as PK. It is positive as well as negative. So what is the serum bicarbonate levels? The serum bicarbs is going to be normal to slightly decreased. It can be normal or it can be slightly decreasing. Next is the question on the arterial pH. The arterial pH is going to be greater than 7.3. Then the arterial PCO2. Arterial PCO2, this is in mmHg. This will be normal. And when we look at the anion gap, the anion gap is going to be normal to slightly increased. Normal to the slightly increase. To learn and grow daily like this, please do subscribe.